welcome to Paisley's East Local Partnership meeting this evening. My name is Councillor Jennifer Adam McGregor. I am the Ward Councillor for Paisley North East in Ralston, and I'm also the chair of this board. So before we get started, I've got a little blurb to read out, just given that the meeting has been held remotely. Okay, so that is just to say that this is an important step for the partnership, being able to hold the meeting remotely. As you know, we're unable to hold meetings in public as usual, in their usual location due to the government guidance and public health measures to tackle the COVID-19 emergency. Therefore, it is important that we take those steps available to us to make the proceedings of this local partnership open to scrutiny, and I can advise that a recording of this meeting will be available to watch on Renfrewshire Council's website following the meeting. To ensure the meeting progresses efficiently, and there are some additional points that I would now like to bring to your attention. That is, number one, it is important when meetings are being recorded that it is only the person who is speaking who has their microphone on. This is because on the recording, if a noise from another microphone is picked up, then the picture of the recording may automatically move to the source of that noise, and you might not want to be the centre of attention at that particular point. So, number two, for the same reason, it is important that you leave a short pause between speakers to enable the camera to adjust to a new speaker. And number three, anyone wishing to speak should indicate this in the show conversation instant message bar, or put your hand up and I'll pick that up and just wait to be brought in by myself. Number four is the content of any show conversation instant message sent on the Teams system will be shown in the recording. Members who are accessing the meeting by phone should also put their phones on mute until addressing the meeting. Now, before moving to the agenda, can I now ask that the clerk do a roll call vote of members that are here so it's clear who is present on the recording. After the roll call vote, I'll now then move on to the agenda. Okay.
I'll just read out a roll call. So we have in attendance Andrew Ramsey. Here. Cassie Forbes. Here. You don't need to indicate you're here. I'm reading out who's here. Sorry. I'll just start again. It's Andrew Ramsey, Cassie Forbes, Councillor Devine, Elaine Locke, Fergal Macaulay, Councillor Adam McGregor, Councillor Sharkey, Councillor McIntyre, Chris Johnson, Councillor McGurk, Piero Piericini, Susan MacDonald. I believe there's a number of officers who are also here. I'll just quickly go through those. It's Alice McBride, Duncan Pole, myself, Robert Devine, John Traynor, who's the lead officer, Karen O'Neill, and Carol MacDonald, and Stuart Gray. Stuart Graham, sorry.
Okay, that's brilliant, Robert. Thank you very much. Okay, so if we just get down to items of business, the first item, well, apologies first. Do we have any apologies intimated, Robert?
We have apologies from Councillor Graham.
Councillor Graham. Okay, okay. And do we have any declarations of interest? No declarations of interest by the sounds of it.
Chair, Councillor Kennedy's apology. Yes.
Okay. Councillor Kennedy. Okay, that's fine. So, so we have no declarations of interest. So the first item would be the minutes of the previous meeting. Do we have any comments or corrections on the minutes of the previous meeting? Just give it a wee second. Okay, so we're all in agreement. We can agree the minutes. Okay, that takes us on to the membership. So I believe we've got some new faces here today. I see Cassie and I see Fergal from the Community Council. Welcome, Fergal. So I'll just I'll bring Robert in here and he can tell us.
Again, I'll just reiterate what you're saying, Councillor Adam McGregor. The situation is that since the last meeting, there's been movement in some of the representatives from the partner organisations and also from the membership of the local partnership itself. So just to let you know, Police Scotland will now be represented by Laura Hamill, Renfrewshire Health and Social Care Partnership by Francis Burns, Ralston Community Council by Fergal Macaulay, and Roar by Cassie Forbes. Thank you.
Right, well, welcome everyone. Cassie, I've heard some great things about you, so I look forward to working with you. And Fergal already know what an asset you are. In fact, when we're talking about partnership working, in Ralston Community Council, they done a recent newsletter and they put it out amongst the residents, and on that newsletter was actually a little card attached to it asking, are you shielding? Do you require any assistance with prescription, or do you even need a little phone call, you know? So I thought that was a brilliant touch. In fact, it's something, there's a partnership that we could actually share, Fergal. We've got 2 other community councils on board here, you know, so that's something they could take as well to have a look at and really spread that good vibes throughout the community, Fergal. So thank you. Okay. So that takes us on to the budget monitoring report, which is number 3, item 3. So we've all had the papers in plenty of time. You've all had a chance to have a read at that. So these papers are for noting the outcome of the Renfrewshire Youth Challenge Fund. So are we all agreed on that? We can all agree to note that report?
Yes.
Agreed. Good stuff. Right, well then, that takes us on to item 4, which is the COVID-19 impact on the communities, and I believe Stuart is leading this presentation. Stuart Graham.
Okay, thank you, Councillor Adam McGregor. If you bear with me a couple of seconds, I'll try and share my slides on screen, and hopefully we can get started.
You weren't expecting me to get to that item so quick, were you, Stuart?
There we go. I was expecting the other one, but or nothing if not adaptable, so we'll see. Here we go. Okay, can you let me know if you can see the screen, the slides?
Yeah, we can see the screen.
Yep,
right, that's great. Thanks very much, and thank you for giving me the opportunity to present this evening to the Paisley East Local Partnership. Really what we're presenting with you tonight is a series of slides, and then we're looking for some discussion with you about the impact on Paisley East of COVID. And if I just kind of give you the questions that are coming up at the end, just to bear in mind as you go through it, we're asking you to think about what the impact of COVID-19 has been in your local communities and the local people that you work with and serve, and also whether you think the COVID-19 would influence the priorities that were previously agreed by Paisley East Local Partnership. And just to recap on those priorities, those were exploring the impact of new housing developments, supporting social connections, and community pride and safety. So you just bear that in mind as I take you through the slides, and we'll have a discussion at the end, hopefully. The purpose of tonight's presentation is to feed into the council's social renewal plan. So it's how we recover as a council area from COVID, and recognising that many different communities, geographic communities and communities of interest will have had different experiences of COVID. What we know is that COVID has disproportionately impacted people across Renfrewshire, and that there's evidence that we have now that the pandemic's exacerbated or made worse the inequalities that we already knew existed before the pandemic began, roughly this time last year. One of the things also to bear in mind is that there's a short-term impact, people that have been affected through their health or unfortunately dying, and also a medium to long-term impact, and that's things like the economic impact on people and the longer-term impact on people's mental health and their physical health, those things like that. As we all know, the ongoing restrictions continue to be felt, and there's a bit of a kind of policy dichotomy between what we do to respond to the public health crisis as it is at the moment, but also what we do to recover from the impacts as a society. And those are decisions that continually need to be adjusted and kind of revised. The council launched what we call a community impact assessment in August 2020, and the aim of that was to speak to as many people as possible and to get as much information as we could to get a deeper understanding of the issues that COVID-19 has produced within our local areas and what the impact of that has been. What we're trying to do is listen to those experiences and learn from them so we can inform the response and address inequalities going forward. So the social renewal plan is a piece of work that the council is working on. which will be presented to Renfrewshire Council in the springtime, probably next month. And what we've done there is we've drawn together data that we know from services, from demands about about the services that people have asked for, national data and local data. So a lot of the things that we know have taken place during COVID-19. We've also launched a public services panel. We've surveyed people in Renfrewshire to get their views, so getting a little bit deeper about what people think the impact has been of COVID-19 has been on them. And we've also had a series of listening events with particular groups, and this is part of that tonight. So we're engaging with local partnerships to get your view now on the impact in the Paisley East area. But we've also spoken to groups including disability groups, ethnic minority groups, women's groups, groups of various different sorts to get their views on how maybe COVID-19 has impacted differentially on those groups. So some of the data and research that we know so far, the data here is probably valid up to the middle of January. So as of then, we had 7,381 cases of COVID, positive cases of COVID in Renfrewshire, and sadly 512 deaths within the area. In terms of employment and support for businesses, we've experienced an 80% increase in people claiming universal credit between March and October 2020. And when we consider the government's UK-wide furlough scheme, at its peak in August 2020, there was 28,300 people registered with that, and by the end of October it was 8,800 people. So that was the extent of people being supported through the furlough scheme. In terms of businesses, we've supported more than 2,500 businesses, and that's a sum of £20.5 million has been directed towards supporting those businesses during the pandemic. So that's just an idea of the scale of the impact on individuals and on businesses within Renfrewshire. Again, in terms of individuals experiencing poverty, there's been a massive increase in crisis grants between March 2020 and October 2020, up from 1,030 in the same period in 2019 to 6,225 in 2020. So that's a six-fold increase in people actually having to request a crisis grant. Over the same period, we have 4,000 contacts with Advice Works, looking for some advice and some help, and 70% of those contacts has been from groups who would recognise as being potentially in priority for child poverty. So we can see that it's the people with the lowest incomes that are being affected here. Increasing concerns since the pandemic started about fuel poverty, which is probably to be expected. If you think about March last year and over the summer, the weather was quite nice, but we had some significant snow during January and February there, and so there's been an increasing focus on distribution of fuel vouchers over the last few months. We've got some figures here from Renfrewshire Food Bank and STAR, but those are only two of the community organisations that have really put their shoulder to the wheel and produced some brilliant work in terms of meeting community needs. And I believe the Darkwood crew are going to be speaking to us a bit later on as well. So Renfrewshire Food Bank has provided food support to 3,148 adults and 1,200 children to date. Again, that's by middle of January, and that's broadly in line with previous years. But if you look at organisations such as STAR, they're now delivering hundreds of food parcels a week. And considering their food pantry in 2019-20, they received 350 visits, and that's now to date in 2020, in the early part of 2021, up to 6,700 people receiving support. So you can see an exponential increase in the number of people coming forward and seeking community support in terms of food. Renfrewshire established what we call neighbourhood hubs right across Renfrewshire to help people who were shielding initially, self-isolating, and now in the latter part, people who have tested positive for COVID and who are maybe needing little bits of support with things like getting access to free food, getting access to fuel provision, and other things like befriending services, and some support that way, some signposting to advice and information services. With almost 700 referrals to the neighbourhood hubs, and 97 of them were in the Paisley East area. And one of the other things that we recognised was that, again, if you consider last March 2020, we were always talking about the digital divide and how people found it difficult to connect if they weren't au fait with digital technology. And as you can imagine, that's only got worse, and particularly for people who weren't digitally connected at the time. So through the Scottish Government and Scottish Council for Voluntary Organisations, 1,250 digital devices have been distributed in Renfrewshire towards individuals who weren't previously digitally connected, didn't have a device, didn't know how to use it. And those devices have been backed up by support, what we call digital champions, so people could learn how to use the devices. And that's connecting children with lessons, it's connecting people with being able to access food deliveries and speak to their families and all those things as well. In terms of health and wellbeing, as we know, there's an ongoing impact on the normal delivery, if you like, of health and care services. So service waiting times have increased. National surveys have indicated that over a quarter of people have kind of held back from contacting their GP about something that they previously would have contacted GPs about. So there's maybe a bit of a concern there about people who aren't seeking medical advice. And a Scotland-wide survey has indicated that between May and July 2020, over half of people said that they felt lonely some, most, or almost all of the time. So a big increase in loneliness is a factor which has already been recognised in Paisley East in terms of supporting social connections as one of your priorities. And also a link to alcohol and drug use and how that's affected people during this key time. So to bolster, if you like, or get under the skin of some of the data that we already know and that we've collected, Renfrewshire decided to issue a public services panel to 1,500 residents within Renfrewshire, and that was by post and by email, so people could respond to digitally or via post as well. And what we're looking at there was looking at how people's behaviours and how their attitudes have maybe changed in the light of COVID. So what things are worrying them? Have they got financial and income worries? What are their family issues? For me, what's their mental health and wellbeing? How's that been affected? Do they have access to support and information, and how included are they in terms of digital inclusion? So we've had roughly about a 59% response in total, 851 responses, 170 from this local partnership area, and we're also undertaking some work to try and improve that take up as well, to try and get as much as we can. But 59% is actually a pretty good response to a survey of this sort. So what I'm now going to present to you is a series of graphs, really about the results of the survey, and I'll try and take you through them. And there's some statistics there that are just relevant to Paisley East, and then some that are Renfrewshire-wide, and so I'll try and take you through them as much as I can do. So one of the questions we asked people was, what has affected them most during the coronavirus pandemic? And if you look at the side of the screen with the bar graph, then you'll notice that the top bar, the blue bar, is Paisley East, and the bar beneath is green, and that's Renfrewshire. So you can see there the differences between some of the areas. In terms of what's affected people most, around 63% have said they're worried about their own future or their family's future. 38% have said they're worried about how to support family and friends who have actually expressed a need for help. Around about 35% have said they're worried about health treatment that they might need, and 29% have said that they report social isolation and feeling lonely as a concern. And if you look at the blue and the green bars at the side there, you'll see that there's probably not too much difference between Renfrewshire and Paisley East on those. Some of them are above and some of them are below, but not a tremendous amount of difference between Paisley East and Renfrewshire as a whole. We also asked people what the major worries were. Probably no surprise that the main one was their friends or their family becoming seriously ill with COVID, and that was 73%. Virtually 3/4 of people were worried about that. 49% of people were worried about becoming seriously ill themselves with COVID. Further 28% were worried about their family or friends' mental health, 22% about their own mental health, and then 11.2% worried about their financial situation or losing their jobs. So over 10% of people were worried about financial matters there. And again, that's probably only got worse as the pandemic has persisted, if you like. We asked people about how they were managing in terms of their household finances. And what we asked them was if they thought back to March this year, how were they managing? Were they managing very well, quite well? Were they getting by okay? Were they not managing very well? Have they had some financial difficulties, and were they experiencing financial difficulties? And we asked them to compare March of 2020 with now and how they were doing. And really this graph can be summed up as saying there's a decrease in people saying that they're managing very well or managing quite well, and an increase in people that are getting by all right, not managing very well, or experiencing financial difficulties of some sort. So across the board, that response, if you like, has shifted downwards from people managing very well to people that are not managing so well or getting into some difficulties. So we asked people if there was help that they feel they currently needed but aren't receiving. And again, the top bar of the graph in blue is Paisley East, and the bottom bar is Renfrewshire. And I think you can see here that there is some difference between Paisley East and Renfrewshire here, and particularly in terms of Paisley East, people saying that they needed help with mental health but weren't currently receiving that. There's more people in Paisley East saying that than in Renfrewshire in general, and the same with financial advice and advice on benefits and help to care with someone else. But interestingly, in terms of help with a health condition unrelated to COVID-19, people in Paisley East felt less strongly that they weren't receiving help than in Renfrewshire as a whole. So you can see it kind of varies, but there's a few things there in terms of Paisley East to bear in mind. And also the other one for Paisley East was support for having lost a loved one. So if people had been bereaved through this period, then they maybe felt that they needed some support, but they weren't receiving that. Again, we asked people to compare March of 2020 with now and how they felt in terms of feeling happy or feeling anxious. And probably no surprise to see that there's an increase in people saying that they were a little or a lot less happy, and an increase in people saying that they were a little more anxious or a lot more anxious. And again, you can see sort of slight variations between Paisley East and Renfrewshire, and Paisley East tending to be a little less happy with their situation now compared to March 2020, and a little more anxious as well. So a couple of differences there. These graphs a little bit more complex. So we asked people a series of questions. There's 2 questions per graph, and I'll take you through them. There's some coloured vertical bars there on the chart. And in terms of Paisley East is right in the middle. So each of those clusters of colours correspond to an answer, and each of the colours correspond to a local partnership. So for each cluster of colours, Paisley East is the blue colour and is right in the middle of each of the clusters there. And then there's also a line connecting each of the clusters, and that's the Renfrewshire average, if you like there, so you can see where Paisley East is above or below the Renfrewshire average. So the first couple of questions we asked were, are you satisfied with your neighbourhood as a place to live, and is your local area a safe place to live? And happily, if you look at the height of the clusters, then most people across the board tended to agree strongly, or tend to agree, that they were satisfied with their neighbourhood and the local area was a safe place to live. In Paisley East, you'll see that there was quite strong agreement that people were satisfied with their neighbourhood as a place to live. It was the third highest for that, and again, third highest in terms of agreeing strongly that the local area was a safe place to live. So relatively encouraging responses there. We also asked, I think I may have skipped one there, yep. We also asked whether the neighbourhood was somewhere where they thought people were kind to each other in general, and where people could be trusted in the local area. And again, happily, the left-hand side of the chart, as you're looking at it, is higher than the right-hand side. So most people tended to agree, strongly or tend to agree, that the neighbourhood was somewhere where people were kind and people could be trusted. In terms of Paisley East, again, fairly high on agreeing strongly that people were kind to each other, and a bit less strongly and tend to agree with that. And again, second highest in agreeing strongly that the neighbourhood was somewhere where people could be trusted. So again, Paisley East comes out fairly well in those graphs compared to maybe some of the other areas. We also asked whether your local area was somewhere that welcomes, that's got welcoming places and opportunities to meet new people, and also if there are places where people can meet up and socialise. And again, if you think back to your priorities, you'd support social connections, community pride and safety, and exploring the impacts of new housing developments. This graph, the shape of it, if you like, is different from some of the other ones, and that the left-hand side and the right-hand side tend to be a bit more balanced. For welcoming places, people tended to think that our places were welcoming, but you'll see that there's probably a higher level of people disagreeing with that and tending to disagree with that than some of the other graphs there. And in fact, most people answered that they neither agreed nor disagreed with that. In terms of Paisley East, again, compared to some of the other areas, comes out quite highly for people saying that there are some welcome places and opportunities, but overall there's maybe some work for us to do there. And then in terms of places where people can meet up and socialise, the left-hand side of the graph is fairly high there. So probably more people kind of tending to disagree that there are places where we can meet up and socialise. But again, you know, Paisley East not too bad compared with maybe some of the other areas. But the takeaway from that one is that people felt that maybe there weren't enough places to meet up and socialise. Another two graphs here. This time we asked whether neighbourhoods were places where people from different backgrounds could get on well together, and if someone was alone and needed help, if they could rely on someone in the local neighbourhood. Again, a lot of people, in terms of if it was where people from different backgrounds could get on well together, a lot of people said they didn't really know, but more people tended to agree than disagree. So that's quite good. And again, Paisley East was second highest for agreeing strongly that people from different backgrounds get on together, and a little bit lower on tend to agree. In terms of being lonely and needing help, most areas agreed that yeah, they would find someone in their local area that would help them. Paisley East is a bit more in the middle here than it is with some of the others, so maybe not as strong an agreement as with other ones. So it's actually third lowest in terms of people agreeing strongly that they could find someone in the local neighbourhood to rely on for this one. So a bit more mixed for Paisley East there. The next two questions we asked were whether people felt they could influence decisions about public services and other issues of public interest in the local area, and whether the neighbourhood was somewhere where local people took action to help improve the neighbourhood. This one, probably more people, in terms of the influence that people felt they had, more people tended to disagree than tended to agree with that, although again, most people, the most common response was people neither disagreeing nor agreeing. In terms of people disagreeing that they had influence in the local area, Paisley East was quite high, so second highest in terms of people disagreeing that they could influence the local area. So again, that's something for us to note. And then in terms of the local area being somewhere where local people take action, more people agreed that local people would take action, and Paisley East was relatively high. It was second strongest in terms of people agreeing that people would take action, and third, fourth, well, sorry, a bit less high in tend to agree, but reasonably high up in terms of people agreeing that the local people would take action here. So that was the public services panel. We also had a series of more in-depth discussions with a series of focus groups over the winter of 20 to 21. Engage Renfrewshire helped facilitate a session with community and third sector organisations. We also spoke to Diversity and Equality Alliance Renfrewshire, so that's disabled groups and black and ethnic minority groups, and also local women's groups in Renfrewshire to see some of the particular effects of COVID. And that's also what we want to get out of the discussion part of tonight, is what you think, so we can feed that back into the discussion as well, whether there's specific things in Paisley East that you want to know, and whether you feel that what we've presented to you tonight reflects what you know in your local communities, or whether it's something different from your knowledge and lived experience there. So those were the listening events, and some of the things that came out to date was that the impact of the pandemic's been greater on people with low incomes and who are more insecure in employment, and it's increasingly apparent to community groups and support organisations across Renfrewshire. So we're really seeing that people in low incomes or in insecure employment are starting to really struggle. Food insecurity and fuel poverty are seen as being particular issues, and there's high demand for community-based support. So people are really looking for things that are based quite strongly within the local community, rather than something which is just run at a Renfrewshire-wide or mere a national level. And partners and neighbourhood hubs are also seeing what we call an increasing complexity in needs and demands. People are coming forward with needs relating to COVID, but also multiple needs as well. So whereas at the start of the pandemic, it was really about food, people were asking for some support because they couldn't get out. Now it's food and fuel, but it's also some health needs and also some mental health needs as well. So it's not always as simple as one thing that people kind of present with these days. It's a bit more complex than that. Again, some of the key points in the listening events: digital exclusion is a key issue. Some people were just about getting by using a mobile phone at the start of the pandemic, but that might have been okay for one adult. But if it's an adult in a family of 4 or 5, maybe having to try and do some work or having to help their kids through schooling, then that becomes a much more significant issue. And there's other groups where digital take-up was much less. The older groups, for instance, and a lot of people have had to learn some new skills during this period. Particular concerns with the ongoing nature restrictions and the impact on health and well-being of people, particularly loneliness and isolation, and also the impact on mental health and well-being. And we've flagged up that young people have been flagged up as a particular area of concern in terms of their mental health and well-being, probably primarily in terms of the amount of social contact that they've lost, as well as the impact on their education. The engagement's also indicated that some specific groups have experienced greater impact, and that includes black and minority ethnic communities, women and carers. And when we asked about what the impacts were, our black and minority ethnic communities spoke about their increased vulnerability to the pandemic, to the virus itself, but also what that meant in terms of how they were perceived within the local community. There was some stigma there, that needed to be addressed, but also in terms of people where maybe the adults in the household didn't have English as a first language, then they felt that was a bit of a disadvantage when it came to helping their children with homeschooling and things like that as well. So there was some particular issues there. Our Polish community felt that they not only had an eye on COVID in this country, but they also had an eye on how that impacted on their friends and family in their country of origin. And also there was the added stress and worry of not being able to travel back home to visit and keep contact with friends and relatives as well. Some of the discussion that we had with women was some increases, sadly, in domestic violence cases, but also the additional burden, or the disproportionate burden for women rather than men in terms of caring responsibilities, which they felt was a bit unrecognised. In terms of caring responsibilities, that was also the issue for carers groups as well. So that shows how COVID has impacted probably everybody, but it's impacted on some groups more than other groups. So thank you very much for listening to me. That was a bit of a I trot through quite a lot of information there, and I'm happy to take any questions that you have. But I'd now like to open it up for discussion with the local partnership here in terms of the two questions we've got here. So what we want to find out from you tonight is, what's the impacts of COVID-19 been in your local communities in Paisley East? Do you recognise what we've presented to you today? Do you think, yeah, aye, that's what we think as well? Or has it been different? And is there anything particular in this local area that you would like to raise? And also, do you think this should influence the local priorities that were previously identified by the local partnership? And again, those were exploring the impact of new housing developments, supporting social connections, and community pride and safety. So I'll stop talking now. You'll be very glad to hear, and hopefully that will open up some debate. Thank you very much.
Well, thank you for that presentation, Stuart. Very informative. I think we can all relate. Some people got their microphones on. Stuart, can you turn yours off?
Yep.
I'm getting a lot of feedback here. Right, that sounds better. I think we can all relate to the impact, how it's affected us personally, our constituents, To hear you saying there's been an 80% increase in universal credit, and not everybody qualifies for universal credit. There's certain criteria. If you've got capital or savings, that they'll avoid you straight away. So to hear there's an 80% increase, fuel poverty, and obviously all our own mental health, food insecurity. Now, on this note, Stuart, we'll come back for debate, but I would like if we could play the video from the Dartwoods crew, because I think this ties in ideally actually to what we're talking about right here. So Robert, could you play that video?
Stuart, could you stop sharing the screen, please?
Aha, I can see everybody. Nice to see you all.
Hi.
Good to see you, Terry.
Nice to see you at the bath, Terry.
I'll not ask.
Terry knows. I know.
There we go.
Terry, I heard you a wee while on Radio Scotland dedicating a song to Mandy, and it was really nice to hear you there.
And I've been watching you in Class Wars, and you were brilliant. So I'll just get that in.
I'm overwhelmed with the compliments,
you're a celebrity, Terry. And here you are in your video.
Okay, we'll make a start on it just now. Sorry,
It's okay.
I'll start again, but can I ask everyone not to do anything on their computers? The way we're doing it, it's quite complex. So if you don't go into an email or something during this, okay, I'll just start it again. Okay, bear with me.
Thank you, Robert. Thank you. It's as if all our faces have been frozen in that space. We're all at this. Here we go.
Oh dear.
Right. Well, I think that was brilliant, Terry. And I think what you've achieved down in Fergusley is something that we're all working towards achieving. You know, I sit in the health board and we speak about the importance of social prescribing and things like that. That's exactly what you're doing down there, you know, tackling isolation, something that's been one of our priorities. You've got that. Food insecurity. Honestly, you're doing a fantastic job, Terry. And what I would like is to work in partnership. You know, we've got community councils here that I'm sure, I know friends and family of mine would definitely volunteer to get something started within the East End. And as I say, we've got 2 community councils here that I'm sure they'd be willing to, you know, dedicate a bit of their time as well to help. So if you could tell us, Terry, a wee bit more, but as I say, I've seen what you're doing, I think it's right. The floor is yours.
Thanks, Ferry. I wasn't sure whether you were able to see the video. My screen just froze, so I'm glad that you were able to see it. It's a wee bit out of date now, and we'd say I think that was done back sometime in August. So we've moved considerable ground since then. But first of all, thanks very much for inviting me along. It's great. I don't often get the opportunity to bum my load, as it were, so I always grab it like a dog with a burst ball, as they say. But yeah, I mean, I think everyone knows that there is a strength of community spirit that exists in Fergusley, which may be slightly biased. I would argue is unrivaled by any other in the country. And you'll understand, whilst it's great to celebrate everything that we've achieved, the absolute need for that to have existed, because Fergusley Park, ordinarily speaking, is a really, really busy community in terms of local engagement. There's always something going on. So for lockdown to happen and for all the support services and networks that exist within the complex community that makes up Fergusley Park, for that simply to cease to be is an apocalyptic situation for us here. And where my concern as a local community activist for 23 years lay was, I was really, really conscious that we run the risk of losing a lot of the gains that we had made over recent years. So for me, the big driving force was just to remind folks that community life continued whilst the world perhaps shut down. And I think the overriding aim for Dartwood Crew, you must remember, set themselves up in line with the kind of green spaces kind of initiative, because we wanted to improve the local village green. It was an area that had never been used for the purposes for which it was built, and had fast become a hotspot for antisocial behaviour, bin fires, fly tipping, all the usual ills that bestow, I'm sure, all of our communities. And the reality was, we got together, we managed to kind of tidy the place up, and from there we developed 5 key focus areas. Food insecurity, fuel poverty, mental health positivity, isolation and loneliness and the local environment. And what we've tried to do is we've tried to weave that environmental influence, if you like, into every aspect of our work. And our work on the Village Green, if you like, was underpinned by a belief that the green space in itself held a number of the keys to addressing some of the wider socio-economic problems that had blighted the community for nigh on my entire life. I was 41 there at the end of January. My community has been regenerated my entire life. If we were organising a funeral, a wedding, a bar mitzvah for that matter, there would be a beginning, a middle and an end, and I'm all for getting on with the end because I was part of the beginning. I've endured the middle out, and it's high time we got into the end, and it's great to see you, Marie. You're very much part of that end part, so keep waving that flag. But yeah, so what we did was try to respond to local needs, but stay true to who we were. So it's not rocket science. It's literally just about joining up the dots. And one of the real lessons I think we've learned in Ferguson, and I tried to kind of make this point throughout the kind of Challenge Poverty Week campaign that we were very lucky to take part in as well, was local communities and local community activists are often best placed to find really cost-effective and indeed wide-reaching solutions on the basis that we deal with the cumulative effects of climate change and community regeneration and COVID pandemics and lockdowns and decreases in mental health and exacerbation, and we deal with the cumulative effects of them every day. Whereas when you work for the council, for example, things can become so departmentalised that, yeah, you've got a climate change unit that are looking at climate change, but how does that also tackle food insecurity, for example? And there is a real marrying up there, and I'd like to think that Crew has demonstrated that wonderfully, because what we've done is we've essentially avoided 16.49 tonnes of food that would have otherwise went in the bin, and used that at a time when our community most needed. And we've delivered 9,103 food parcels. We've driven 13,500 miles in order to achieve that, 4 co-ops, 4 local Greggs stores. And in addition to that, meeting local needs whilst also contributing positively to the environment by avoiding 75 fridge freezers and washing machines and what have you for clogging up the street corners and our parks, by rehoming them and finding them somewhere else to go. Because guess what? That single mother up the road with 3 wains whose wash machines broke down absolutely needs that. One man's treasure, one man's rubbish is another man's treasure. And again, these are the very simple things in which you can make the climate change challenge, the climate change emergency, absolutely relevant to Margaret. Margaret's no interested in saving 1.2 metric tonnes of carbon if she showers 5 less minutes a day. Margaret is interested, however, in saving 30 quid off her top-up electricity meter, and that's how you make it relevant to Margaret. Then you look at the community meal. The community meal, for example, has fed 1,000 people in Ferguson Park, all cooked and prepared by volunteers and all paid for from plastic bottles and cans that's been collected whilst we've sought to improve our local environment. So again, these are cost-effective, joining up the dots solutions. It's not about reinventing the wheel. It's about supporting local people. And I'll tell you, by God, they'll amaze you with what they come up with, because every day I am amazed with the kindness that's displayed, the ingenuity that's displayed, and every single idea. I suppose I should come on to our kind of perhaps most prolific or infamous one, which is the bingo bus. And now, you'll have no idea how excited I was to have the BBC rumble into Ferguson for a positive reason. So, that straight off the bat, that's a positive. But what that did was it allowed organic support networks to form naturally without our interference. So, an example being, the bingo bus was able to visit every single street in Ferguson at least twice throughout the course of the pandemic. There was a whole interactivity on where it would go and who was deserving and all that. So again, it's part of that reminding folks that community life goes on despite the fact environments have changed. And by doing so, we were able to identify exactly who was vulnerable, who lived on their own, that wee woman that nobody gives us stuff about, etc., etc. So it genuinely allowed us to adopt and foster that one community approach. Nobody, literally, nobody was left out. And one wee woman, I remember, we had been regularly picking up her prescription for her. And she messaged our Facebook page to essentially tell us, to say thanks very much for bringing the bingo bus to her street. It was the first time anything like that had ever happened in her street. She'd lived there for 23 years. But because of that, there was no need for us to now pick up the prescription, because Jean across the road incidentally picked Frank, her husband's prescription, up the same day. So she was just going to get it. So do you get my point there? It's that
I was making those community connections. You know, somebody would be nice and getting them out. I see that by your market, Terry. Individuals saying, even, you know, before COVID, we had agreed that social isolation was something we wanted to tackle, you know, and then obviously this happens and the government guidelines are isolate yourself, you know. So to see people in a COVID safe way, arriving there, interacting, getting the food that they require, saving the food going to landfill, honestly, Terry, I can't commendate you enough for the work you've done. I think you're brilliant, I really do. Yeah, and I say, I just wish you were in this partnership, but listen, you can come along as a guest anytime and we'll take all your advice. So I'll open it up now for discussions. As Stuart was saying, if we revisit what our priorities were, what we agreed, and whether we have a wee discussion around that and see whether there's one or two that we'd like to change. Okay, so I think that's, so I'll just open this up now for anybody, any comments. I see Elaine has got your hand up. Elaine, would you like to come in?
Hi, thanks very much for the presentation, and Terry, I love your enthusiasm. That was just gorgeous. Stuart, from the people that were consulted, look, I'm wondering about the loneliness issue, and I'm wondering in particular, knowing the difficulties for people that are hard of hearing and deaf with everybody wearing face coverings, and wondering about the needs of that particular group of people who might be particularly disadvantaged in the last 20 months. Can you give us a bit of feedback, Stuart, about people who are hard of hearing and deaf and about those particular needs?
Yeah, thanks, Elaine, for raising that. I don't think we had any specific feedback from that community, but I think you're right in the sense that there's been a lot of sort of evidence-based that obviously if you lip read, for example, then you can't lip read if people are wearing masks, and that then becomes very difficult for people. So that will have greatly increased people's difficulties, and especially if this, you know, if the practice of wearing masks persists, if you like, into whatever becomes normal behaviour afterwards. So thanks very much for pointing that one out. If anyone has any specific research or evidence from that community, we'd be really pleased to hear it.
It might be, Stuart, where depending on local groups, I don't know whether there's a group for people that are hard of hearing, but we know from the evidence base over time, people that are hard of hearing are more vulnerable to depression at the best of times, and where there's that simple lack of kindness with people wearing face coverings, the lack of smiles even between people, you know, that can increase isolation. Maybe that's something we could look at a bit more closely locally.
Thank you, Elaine. That's really helpful.
Okay, thank you, Elaine, for that. I know that does make a tremendous difference, obviously, with the mask. My father used to be hard of hearing in his left ear and used to lip read quite often, you know, and people would they would never realise that my dad, and as he got older, his good ear was failing, you know, so he relied even more heavily. And if there was any background noise, forget it, you know, so I can, and then now obviously with the face masks. So that's a valid point, Elaine. What I'm always concerned about is the hard to reach people, the people that haven't taken part in these surveys, you know. I know from my constituency side of work, you know, I might hear a lot from my residents within Whitehall and Ralston, not as much from my residents in Seat Hill, and I guarantee you they really need the help, the residents in Seat Hill, you know, and whether they're not active in the computer or whatever. But as Terry says, that isolation bus that he took down into Fergusley got the residents out, and then they were actually able to grassroots identify who's isolated, you know. So these are all things that I really think that I'm definitely going to take on board as a partnership and see what we can do. Okay, any more comments? I see Councillor Devines gets hand up. Come on in, Eddie.
I'll not describe how I know about Terry and his bath, but Terry knows these people as well. I would like to pay. Terry's doing a really good job down there. He knows. I know. I've told her that before. But there's other people. Sorry. There's other groups as well. I've got one in Glenburn, which is the Stronger Communities in Glenburn. There's also a fantastic group, as Terry knows well, as EBI down in Erskine, Bishopton and Shannon. They do a tremendous job, and although it looks as if they just give out food, or they don't, they do every single thing that Terry's talking about, and it's people like that, groups like that, not people, because nobody, even Terry and the others, they don't look for it individually. It's their groups that do it. And probably he's right. Us as councillors should pay more attention. I know it's difficult, and so does all the other councillors on here. It's not always as easy as we'd like it to be to give money and help and all the rest of it, because we do sometimes get stuck up in other things. But it's a great thing, and it's good that as Terry's there, Erskine, Bishopton and Shannon's got one, and Glenburne's got one as well. So well done to Terry and his troops.
Thanks for that, Eddie. Okay, right, I see a couple of hands up now. Terry, I think you were first.
Yeah, just very, very quickly, because Stuart, your presentation is fab, and I'll be honest, it's the third time I've had the privilege of viewing it. So, and it is nice to hear your amending of it. What I mentioned this at a Poverty Alliance event with the council recently as well, and one thing that I would say, just in terms of the presentation, I think it runs the risk. So, for example, it makes the comment that there's an 800% increase in universal credit, something you picked up yourself, Councillor Adam McGregor. And then it also speaks about how the Renfrewshire Food Bank saw no significant rise in approaches for food, and thanks to community food. And I think that, in a sense, if you like, I think that undersells the concept of what community food is, because I think that the complexity of that term community food is so rich and so diverse that as a council and as a whole community, we really should be learning from that, because we're feeding people and it's not costing us any money at all. That's the root. That's the truth. So this nonsensical suggestion, which seems to be rearing its ugly head now about us inadvertently creating dependency levels. I know not of a single person who is dependent on a loaf that went out of date yesterday. So, and that's the reality of what we're chatting about here. So whilst it may suit some to argue about dependencies, that's literally not what's happening in our communities. And I think if we're not mindful of that, we run the risk of not fully understanding the problem.
Okay, thanks Terry. The clever bits in the presentation were Annabelle. She did all the put all the presentation together, and I think you're absolutely right. I mean, it's not just food that the community groups have been, actually delivering to people is much more holistic than that. And actually, I think it's one of the key points about the loneliness and isolation, about actually getting to know people that Councillor Adam McGregor described as hard to reach. There were people who were maybe nowhere near any services or any community provision before this, but now we're realising they might come and they might ask for, as you say, Terry, the loaf that's maybe coming up to its sell-by date, but they've actually got other needs that we can connect and hopefully tap into as well. And I hope we haven't undersold what the community groups are doing, because it absolutely isn't just food. It's real kind of wraparound support that's been doing. And I think one of the other things maybe that we need to recognise is the way that's evolved as time's gone on. So it's not that people have started doing one thing and just kept doing the same thing. all during the pandemic. It's continually evolved and continually changed, and you know, hats are off to all the community groups that have done that.
Sure, maybe you could just clarify that point for me. I mean, I think the food bank is remarkable. They do a fantastic job, but somebody brought to my attention recently that you can actually only go to the food bank twice. Is that correct?
They limit sort of how many times people go to them. So they, you know, they're obviously trying to serve as many people as they possibly can, and trying to make sure that people
twice a year, but I have twice a year, sure.
I don't think. I think they've always got flexibility if people are in real need, and you know, wouldn't try and, you know, wouldn't turn people away. But again, that's one of the things to continue work with people to see, you know, what actually is the root cause of the issue here. You know, so is there more advice that can be given? You know, more benefits advice? Is there income maximisation? Are there other things that come on to, you know, to just try and make sure that people aren't in that situation as often as possible, which isn't, you know,
I think we've had the situations as we're looking at an 80% increase in universal credit, and we know that universal credit is just going to be enough to get by. You'll be lucky to pay your essentials and live on that. So, you know, you're talking about a lot of working poor here. You know, a lot of families will be affected, and I think that's why the work that Terry is doing with regards to food insecurity, saving food from going to the landfill and all the rest, I think that is a tremendous job that he is doing down there, you know, because there's no stigma. They're going to a community market there. There's no stigma at all, like the food bank or anything else, you know. It really, I think, honestly, Terry, well done. Anyway, enough of the Terry fan club here. Let's move on to some other guests that are here. So, do we have any other comments? I see Councillor Sharkey has his hand up. Councillor Sharkey, would you like to come in?
Thanks very much. I think a lot of the discussion up to now has actually been about, you know, there's that phrase about getting back to normal. A lot of what we've been talking about was normal before COVID, and we're talking about poverty and you know, the action of poverty, the failure of the current benefit system to address that and deal with it in any long-term rectification. So we're always going to have to be dealing with poverty, and possibly what we should be doing, instead of talking about going back to normality, is asking, that normal that was the other side of COVID. Maybe it's time to look at that and think it wasn't so good, and maybe we should be looking to not going back to normal, but going back to better, and going and getting something better. But just as in terms of this, this report that's in front of us, very good at detailing, as I said, the problems that we're looking at, and seeing some of the effects, particularly this one about the 80% increase, right, in the benefits. But I would have been looking for something more in terms of what are the behaviours that have been most efficient in spreading COVID, and what do we do about those behaviours? And has there been any particular association with an activity or a group that actually spreads the disease in this way? Because if we're looking about dealing with COVID, then certainly we'll have to look at the way people have been reacting, and see if there's something that we can do in that way. And I mean, absolutely take the point. Sorry, I can't remember who was said it. I think it might be yourself, Stuart, about the wearing of masks. I mean, I think that's something that's going to continue long after somebody stands up at a podium and tells us that COVID's over. I think we'll be able to see that for a long while after that. And what are going to be the effects? Are they the effective way of treating it, or is there other behaviours that we should be looking at, and who's doing that work?
Okay, Stuart, would you like to come in?
Thanks, Councillor Sharkey. I don't think that's something that was kind of within the scope of this particular piece of work, but I think, as you say, as we come out and we maybe talk about getting back to normal, but this is maybe one of these occasions when there's a before and an after, and it's just how we cope and as you say, change things afterwards. I'm not sure that there's been the kind of certainly at a local level, I kind of look at the behaviours that have spread the virus. Maybe my data colleagues know more about that than I do. But certainly one of the things that we'll need to look at is how we organise ourselves going forward, in terms of making sure that COVID or any other similar outbreak doesn't take hold of again. So I know that there's a lot of work going on in terms of how our buildings and how we utilise buildings and how we interact there, and how that can help maybe reduce the spread of COVID or other kind of similar viruses as well. So I think those are maybe that's maybe the very early days of thinking about that yet, and probably wasn't how we were thinking about organising our public spaces before now. But you're correct in terms of how we put on public events and how we organise people getting together. I think those are all things that will all now need to be thought of in a new light, if you like, and that will be part of the recovery journey, but it wasn't part of this particular part of the exercise.
Okay, thank you for that. With regards to your question, Councillor Sharkey, I think it would be better directed to Tiona Strachan. She's David Leacy's new replacement, and she would certainly be able to tell you more on that. I sit in the Integrational Joint Board, and certainly we haven't been given that kind of information. In fact, we were actually told at that point in time the cases were so small within Renfrewshire and pockets that they couldn't tell us the areas because there'd be a fear of actually identifying the people that had COVID. But what I do know, what influenced Renfrewshire's figures, I'm sure you know yourself, Councillor Sharkey, is the national care homes that we have within Renfrewshire. So that obviously did, when it came to Renfrewshire's figures, certainly. But as I say, Tiona Strachan's your woman for that. Okay,
no,
so
I'm
any
happy
other
to have you
questions?
pass on the questions next time you sit on that board.
Okay. Where are we? Right, so I believe, was it yourself? Next, Eddie. I'll bring you in next, Eddie. Okay, Eddie, come on in. Mike's still on, Eddie? That's you.
I know we keep calling them, but we all refer to them as food, these like Terry's and EBI and stronger communities. But these people, these groups are not just food banks. These things have grown into everything. Terry will know what I'm talking about. People go there, all right, they go there to get their food, right? But it's much, much, much more than that. I've been to the Renfrewshire one down in Paisley. The council, to our credit, there's people there helping folk out with all sorts of things, and it's all done privately and with respect and all the rest of it. Nobody's looked down on because they're there for food. EBI is the same. It's massive what these. I'm saying these people, but you know what I mean. It's massive what these groups are doing, and it's high time we actually funded them to do the job. If we have to fund so-called food banks or the Dartwood crew to do our job, then we should be doing that, because people in Ferguson, Erskine, all the places where we live, even in Ralston, they need people like Terry and like I can't remember the woman's name in Erskine.
Jackie,
and the girl up here as well, Yvonne. They're the stuff that they get involved in, and nobody knows about it. They just say, "Oh, it's a food bank." No, it's not just a food bank, and it's to Scotland's shame and probably Britain's shame that we still refer to these things as just food banks. They ain't. They're social enterprises that should be funded properly.
Absolutely.
I agree with that, Eddie. Absolutely. Okay, so we have Elaine. Elaine, apologies, I never saw your hand up there, so come on in.
That's okay, thanks. I was just kind of following Councillor Sharkey's question about the spreading of the virus and what needs to change over time, and kind of thinking too, I'm sure folks have seen this week, there was a national survey about where people like to live, and Paisley came out top of the pops.
Yes,
with
yes.
Green spaces and culture as being really important. And then kind of thinking back to your own comments about people in Seed Hill and what do we need. I live at the bottom of Seed Hill Road on Cochrane Street, and as well as being part of Paisley Opera, one of our difficulties has been all the concerns about, and the same as all the other choirs in Paisley, for singing as a way to spread the virus. And we've been able to do some stuff on Zoom. But of course, there's concerns about how we enable those cultural activities, the choirs, for people to be able to hear and participate in events in the future. And one of the things that I've kind of noticed a change, I also volunteer with Friends of Barshaw Park in looking after the Peace Garden. And those of you that have been in the park, I'll maybe have noticed that although we weren't able to look after the Peace Garden as a group, one at a time, we've been going and weeding and doing things. And when in the park doing a bit of weeding, it's also been an opportunity for one-on-one conversations with many of the folks who've been using the park because of the social isolation and loneliness. Particularly, I'm thinking of conversations with older men who've been maybe sitting on one of the seats and them talking about the difficulties for socialising because the pubs have all been shut for so long. So the parks have been well used in many different ways. But one of the things that's kind of noticeable too is, and particularly at the beginning, the first lockdown, and maybe less so at the minute, but dog owners in green spaces were kind of taking advantage of less, when there was less people about, and no picking up after their dogs. And one of the things in kind of thinking that people need green spaces more than ever. So yes, we need to have spaces where people can exercise the dogs, but we also need to have politeness between different user groups in our green spaces. And we need to kind of, I think creatively about our green spaces as venues, both the wee park in front of Cochrane Street and Barshaw Park, people exercising together and doing sort of formal exercise classes in very small groups. But that's becoming much more noticeable, that people are doing their exercise because the gyms have been closed for a while. So that kind of thinking about how our green spaces have been used and how we can enhance the use of our green spaces to make best use of them while keeping them safe places. Sorry if that was a bit of a rabbit.
No, not at all, and some great points there. And you're absolutely right. I've been round the park to try and get my daily exercise, and Barshaw Hill gets the whole heart going, let me tell you.
Yeah.
So, and I have heard about your plans for Barshaw and some future, hopefully, plans that you've got in the pipelines, Elaine, with regards to. Yeah, so I'm quite excited to discuss all that with you. So I'll meet up with you at a later date and we can sit down with that.
There's a lot of very enthusiastic people, and I think for folks who are lonely, not just the doing the work in the garden, but the Friends Group Facebook page has been a way of folk catching up who might not have been able to get to the park, but to see like the Barshaw boa, the snake with the painted stones for the kids. The older folks have enjoyed seeing that on the Facebook page. It's created conversation to reduce isolation.
And that's how it gets started, absolutely, Elaine. And I hear you've been successful in a grant for, I'm not sure what it is it a 20-foot dinosaur? I'm not sure, I just heard through the grapevine.
I don't know about a dinosaur, but there's several grant applications in at the minute. So.
Oh, well, then I look forward to seeing where it goes. All righty, where are we? Right, okay, so Robert, could you just clarify who's next? Is it Terry or Councillor McGurk?
I believe it's Terry, then Councillor McGurk.
Okay, then what is your favouritism there? On you go, Terry. Oh, your mic's on, Terry.
Yeah, it was just one final point, and I think it ties what Councillor Devine and Councillor Sharkey were both saying, and wonderfully, really. Eddie's quite right, frankly. These groups aren't just handing out bags of shopping. I mean, Dartwood Crew in particular cut every blade of grass in the entire community of Fergusley Park during the lockdown because the council weren't adhering to their responsibilities at that particular time, because it was fundamentally important within the likes of places like sheltered housing complexes, 21 shielding residents. All they had to do was look out the window. The least we could do was make sure it was all decent for them. So there was all sorts of things, and it was done with genuine care. But to tie in with what Councillor Sharkey was saying as well, Fergusley Park as a community had already started off at a lower base point than everywhere else. Darkwood Crew's 5 key focus areas, they existed long before COVID came into play. In fact, without overstating this, you'll never quite understand how delighted Darkwood Crew that the rest of the world had joined the party. And I think that underlines the point here. Communities have been empowered off the back of COVID to tackle the challenges that they're faced with in much bigger ways than they ever thought possible before. And I can only speak as a community activist, but I do feel at times, certainly as time is going on, organisations like Dartwood Crew, EBI Unite, Stronger Communities, Glenburn, et al., they're now being seen as surplus to requirement. And there is an almost concerted effort of almost rewriting. And that was why I felt slightly aggrieved. And I'm very pleased to have taken part in tonight's meeting, because I think it is important that we celebrate that, because as a council, as we go forward with cuts in the pipe, I mean, these cuts aren't even in the pipeline anymore, they're in the post, let's get real. So as a community activist, that concerns me, because I know that those funds that we've perhaps not even been taking advantage of in times gone by, they're going to become lesser and lesser as time goes on. And now there are more fish in the pond, but there's a real appreciation. I know from a Fergusley Park perspective, there's a real appreciation culture. We know that when this is all over, we're going to have a higher engagement rate than we've ever had before, and it'll undoubtedly be motivated by gratitude, because, oh, that shower helped me when I was needing, and I'm going to give something back. And I think we as a council need to prepare for that, because I think what we have done is we've raised the expectation levels, and I think that it's incumbent on us to, at the very least, maintain that.
Absolutely, Terry. Listen, behaviour breeds behaviour, whether that's good or bad, and it's certainly great as far as the community in Fergusley goes. You know, you've got a really strong, really, you know, a community that a lot of us would be grateful to have that community spirit, and I'm sure we do have, you know. That's why we're all taking part in this partnership meeting tonight. Councillor McGirt, can I bring you in next?
Thanks very much for that, Jen.
Your mic's on, Marie.
I know, I'm trying.
Oh, you've got a sticky button. That's you.
I don't think so.
Oh yes, you've pressed it. See, I do that when I'm trying to load my computer. I press the enter button so much times, and I always have Councillor Hughes' voice in my ear saying, Jennifer, you're confusing the computer. That's you. You're with us, Marie.
I think that's me now. Thanks very much. No, it's been really enjoyable this evening. Gosh, you're really quite a motivated bunch, which is lovely to hear, to be honest. It's nice to see you, Terry, and thanks for your wishes. And I'm really looking forward to coming down next month to see when the diggers go in and start building those beautiful new homes for everyone down in Tannahill. But one of the things I would say that I've really enjoyed tonight is, and I know Eddie and I are on Glenaffer, and Chris is on the Glenaffer partnership. We are very pleased with the local community groups, in particular, Glenburn Stronger Communities, because they do massive work and they've been doing it for such a long period of time. It's not just because of COVID, but it's because of their keenness to actually help those in their wider community. And my job is, and other members' jobs here, is to try and make sure we empower those community groups as much as we possibly can. And that's the same with Fergusley, and that's the same with anywhere else in the Erskine too, Jackie Reid doing all the work that she's doing, and with all the issues she's had to face all along the way, she's managed to achieve it. So it's really important that we get together as members to make sure we can help these people do that. There is no doubt in my mind their jobs are going to become bigger. They're going to need more volunteers to come on board to help them. I know that Roar did a great job throughout the whole COVID for us, get in contact with people in the community to try and deal with isolation of loneliness. I had meetings with officers every other day just to make sure we had enough volunteers in the area to be able to do that. But it won't stop after maybe lockdown eases. We'll actually need this more and more. But I'm so pleased to see these groups being empowered. And there is funding there for empowering communities. We've got it in the council, and they should just come along and get some of that money and help them to establish some of the future works they want to do. Food is a major one. I think growing grounds is quite important. I think we need to have more of them throughout the whole of the county, and I'm very keen to help any group that wishes to do that. And we've got other groups who want to come along and help people to establish those too. So there's a ton of work ahead of us, actually. We're not going to be just sitting back and doing nothing. There's a lot of work ahead of us, and it's nice to see these groups on board. Thanks for that.
Thank you, Marie. I completely agree with your comments there. And I'm really for the growing grounds as well, you know, absolutely. Right, who was next, Robert? Do we have any more hands up there? If we don't, then we'll go back to your...
I think Stuart might have the influence on the local priorities that have previously been agreed.
Yeah, that's what I was going to ask, Robert. If Stuart, you want to go through that, then we can discuss just one at a time. If we take them one at a time, then we can discuss as a partnership what we think about that priority, whether it still is important to us now or whether we want to look at, you know, revising that. Okay, Stuart?
Okay, thanks, Councillor Adam McGregor. So we had three priorities in Paisley East. The first one was exploring the impact of new housing developments, and what you'd said at the time was you wanted to explore how people influence planning decisions around new developments and making sure that infrastructure is in place to support these developments, for example, roads, schools, nurseries, and explore how community benefits might be used to support this. So that was your first one.
Okay, right. We'll just leave it at that just now, sure. So how do we feel with regards to that partnership? I know that was actually brought to the partnership with the thought of Dyke Bar development in the forefront of everybody's mind, because obviously at our community council meetings there was always concern raised with regards to education, with regards to the infrastructure for the roads. So that was actually put forward by an old chair because of that. Now, as you might all be aware, Councillor McGurk moved against that to refuse the development in Dyke Bar. So that was actually a very welcome decision from certainly both my community councils. And I would now like to open up to the partnership to see whether they still think that this would be a priority that we should keep a hold of. Okay. So I would ask for opinions. Andrew Ramsey. All right, he's left. I thought he had his hand up. Okay. Right, Elaine, I see your hand is up.
I think having followed the Dyke Bar discussions, I think one of the issues is not just about infrastructure, but about access to green spaces and maintaining green spaces that are valued by the wider community. And that's been, I think that's one of the things, if people nationally are seeing Paisley as a good place to live because of green spaces, then we need to not just maintain what we've got, but we need to enhance, improve and extend green spaces, because we know from the evidence for mental well-being that access to green spaces is really, really important for mental well-being as well as physical well-being.
Okay, yeah, absolutely. I mean, see, at the end of the day, when I think of it, sure, it's not as if we're restricted, we can only have 3. I mean, really, we can just have additional ones that we feel are apparent. So if everybody's agreed that these are still our priorities, but we will add, you know, tackling isolation, tackling food insecurity, tackling these kind of things onto it, then so is everybody else in the partnership agreed that we should actually keep this exploring the impacts of planning on our priorities? Okay, somebody agree with me?
Yeah, I agree.
Good. I see Fergal's nodding. Okay. Right. So, sure, could you read out the second priority, please?
Okay, the second one is supporting social connections, and the local partnership want to support social connections to tackle isolation and promote mental health and wellbeing. They want to see groups in the local area working together, swapping skills and sharing resources.
Yeah, that's all. That's of course that's what the partnership's all about. So I wouldn't suggest that we move away from them. I would suggest that we add to them. And I'm mindful that we have a couple of minutes left on this. Councillor McNaughton, I see your hands up. Do you want to come in?
Yes, it was actually on the previous item, just the priority on the planning. It was just to say that there is a distinct change in planning, and there's a move towards much more use of the local place plans, which allows communities to set out how they would like their area developed, and it could address exactly that, access to the green space, and then that should feed into the local development plan, which is the formal statutory plan against which applications are assessed.
Thank you, John. Okay. Stuart, do you want to just read out the
third one? Yep.
Yep.
The third one was community pride and safety, and the local partnership want to see the care and maintenance of their spaces across their area, so they are clean, safe and attractive spaces. They want to see these spaces used to promote good wellbeing across the area.
Well, these are all valid things. These are all things that we're tackling with our team up to clean up and everything else. These are things that certainly all my constituents feel very strongly about. What I would recommend adding to that would be the kind of tackling food poverty, because I just think, see, with an 80% increase in universal credit, and I'm mindful of the fact that not everybody qualifies for universal credit, so I just think that is a massive, massive impact for us to have within our local area. So I would really be minded that we try to work together as a partnership to pull something together with that. Elaine, is that legacy hand, or are you coming in?
No.
Okay, Elaine, come on in.
Not just tackling food poverty, but following from what Terry was saying about reducing food waste and reducing things going to landfill. That's sustainable use of resources. It needs to be fundamental.
Yes, well, that's it. It works hand in hand, Elaine. You know, that's the beauty of what Terry is doing. Not only is it bringing people together, but it's tackling is food poverty, and at the same time it's preventing us going to landfill. So I really think, you know, I would like that. Right, what's this? Is this all right? Somebody's agreeing with me. Right, does anybody have any other contributions? You know, I'm mindful that we literally have a couple of minutes left before, I don't know whether it automatically cut us off, Robert, or do we have a bit of scope with it? No, it won't. That's good. Thank you for that.
Can I just say there's no issue with the time?
All right, good.
No issue with the time.
Right, that's fine. I know that some of these meetings, that once you've reached your time, it just cuts you off. You know, maybe that's because we're doing it via Zoom.
Chair, some of us have our tea to get right enough.
Right, so, okay. Well, if you don't want to stay any longer than this, then you're welcome to leave any time you want, Councillor Sharkey. Right, okay, so any other contributions? Okay, so, okay, sure, if you want to, right, so you've got the new addition then to our priorities.
Yes, tackling food poverty and also reducing food waste, looking at sustainable use of resources. And what I can do is I can write that into a form of words for you, so we can have it on the minute of the next meeting. Robert, would that be how it goes? So we can probably agree at the end. But that's great. I've got that. Thank you.
And Cassie, I think you'll be invaluable as well with the contacts you've got in Roar for helping us identify as well people that are isolated and that need our help.
Could I just come in, convener, and say that there was a couple of comments with people saying that there was problems with the video, with it either freezing or they couldn't hear. So what I'll do is I will circulate a video link so that people can see it and hear it in their own time, but also I'll circulate the form of words that Stuart formulates with the revised priorities. I'll hopefully get that out to you tomorrow, okay?
Super, Robert. Thank you.
You could, of course, just visit the Dartwood Crew website, shameless plug, www.dartwoodcrew.co.uk. You can even report lighting problems that's connected to the council, the fly tippers, all sorts, but we're very much in partnership with the council, so I would strongly encourage you to visit us.
Oh, listen, I think you'll find I'm already probably one of your top fans on that webpage. If I'm not, I'll make sure that I am. Okay, that's great. So is there any other contributions before I wind up this evening's meeting? No. Well, I'd just like to take this opportunity to thank you all for your time for coming along this evening. I really have appreciated all your contributions, okay? And it's so nice to see the new faces as well, you know, yourself, Cassie, Fergal for the Community Council. So it's really good to see you. We've got a really great partnership here, you know, and we can make a real sustained difference within our area. So I look forward to it, okay? So thank you again, everyone. And Robert will get you a copy of Terry's video out to you, okay? And I'll see you all at the next partnership meeting. Okay, take care. Cheers. Bye-bye.